Good afternoon, everyone, and thank you to SAGES for allowing me to present today on our postpartum reflux patterns compared to GERD patients with normal motility. I have no disclosures. In the past decade, we've really seen POEM gaining popularity in the treatment of achalasia worldwide. And we know studies have shown that about 20 to 45% of these patients will develop GERD after undergoing a POEM, but most of these will remain asymptomatic. However, little is really known about the specific reflux patterns for these patients. The objective of our study was to characterize the specific reflux pattern in patients who underwent a POEM for the treatment of achalasia. We hypothesized that patients with GERD after POEM are more likely to have characteristics of stasis, such as greater reflux when they're supine and longer reflux episodes. This was a retrospective study at a single academic institution. We compared the reflux characteristics between patients who underwent a POEM for achalasia to GERD patients with normal motility on manometry. We only included patients who had an elevated Demeester score on a 48-hour wireless pH test or a Bravo study. And GERD patients who had ineffective motility were excluded. It's our practice to place our POEM patients on a PPI for 3 months post-op and then to obtain a Bravo study at 6 months, which is the reason we use this to identify our comparison group. We compared the individual components of the Bravo tracings between the two groups, which are listed here. We had a total of 19 post-POEM patients who had an abnormal Bravo study and 26 GERD patients with normal motility. Both groups were similar in age and BMI, and you can see, even though they both had similar Demeester scores on their pH study, the GERD patients had significantly higher reported GERD quality of life scores. Looking at the specific Bravo tracing components, you can see the total percentage of time in reflux was similar between the two. The post-POEM patients had less percentage of time in reflux when they're upright and a greater percentage of time in reflux when they were supine, when compared to the normal motility GERD patients. The GERD patients had almost double the total number of reflux episodes and double the number of reflux episodes that lasted more than 5 minutes when compared to the post-POEM patients. However, the mean longest episode was greater in the post-POEM group. There are several limitations, a pretty small sample size at one single institution, and we weren't able to capture the non-acid reflux. So in conclusion, we identified that post-POEM patients with GERD have greater reflux when supine and tend to have the longest episodes of reflux when comparing them to GERD patients with normal motility. This information can help us with managing reflux in the specific population by recommending a PPI at bedtime, elevating the head of the bed, and performing routine endoscopic surveillance. Thank you, and I'll be happy to take any questions.